Hello everyone, it's Northpolepenguins here. I'm sorry it's been a while since my last upload. It's been about a month. I've had a lot on my plate and unfortunately just haven't had the time to make a new video. With that being said, I can't thank you all enough for the amazing support over the past few weeks. You've all been fantastic, so thank you so much for that. Today I want to make an update on the coronavirus. It's called COVID-19 now instead of nCoV 2019. I want to make an update on the global situation regarding this. Holy shit, I only thought that toilet paper would be a valuable resource in a doomsday scenario, but apparently this is it. Toilet paper has been sold out in various places in Australia, Canada, and it's even now hitting New Zealand. Several other amenities like hand sanitizer, face masks, hell even large bags of rice are sold out. People are panic buying everything that they can get their hands on for the apparent inevitable end. Also, people are just scared about Corona, the drink, as well. What the heck's up with that? Well, I'm here to say not to panic. Panic is significantly more harmful in the long run than the actual disease itself. But what can I do to protect myself, you might ask? Well, as I discussed in my previous video, and has now been confirmed, the disease can remain on surfaces as fomites for up to 4 days, and in the air for several hours. Though it is not strictly airborne, the disease can remain in droplets in air for many hours. Standard protective, non-ventilation masks do not prevent you from contracting the disease. Rather, they stop the disease spreading from those who wear the mask. So I hate to tell you, but those who brought masks, you're not protecting yourselves, but you're protecting others should you contract the disease yourself. One of the biggest vectors for transmission of the disease is improper hygiene practice, given the disease spread mechanisms. What do I mean by this? Well, touching things in public and then touching your face, or eating without washing your hands, is one of the more likely ways you'll become infected. I would recommend carrying a bottle of hand sanitizer, or failing that, wet wipes and soap, along with being mindful of not touching your face. As I've previously mentioned, we touch our faces a little over 3 times per minute, which, considering you may come in contact with surfaces with the virus out in public, this becomes a significant vector for transmission. So stop touching your face. The primary fatality statistics thus far show an exponential growth of cases, as I figured that would happen with a significantly large basic reproductive rate, or R0. The current fatality rate is between 5% and 9% currently. However, this is significantly skewed by elderly patients and those with existing conditions who may be more at risk. For the age range of 0 to 50 years old, the fatality rate is between 0.2% and 0.4%. Bear in mind, those who tell you this is flu-like are definitely wrong. So flu has a nominal fatality of about 0.06%, less than a third of the fatality of COVID-19. When taking into account approximately 25% of the population have pre-existing conditions, which may result in COVID-19 having a larger fatality among the younger population, the pre-existing condition-free fatality rate is approximately 0.15 to 0.3%, or about 1.5 to 3 in every 1,000 people. This is still more than double the seasonal flu. So yes, it is more significant than the flu, but it's definitely not as bad as, say, the plague or Marburg viruses from a fatality point of view. People above the age of 55 and those with pre-existing conditions are the biggest factor of fatality. People with existing respiratory, cardiac, nephrotic or kidney conditions and diabetes are at most risk. For those people, I would definitely recommend social distancing as much as possible to limit the ability of viral contraction. The main issue with the virus is its asymptomatic spread. You may not even know that you have the virus until you've subsequently infected several people. Therefore, there really are only 2 options. Either significant social distancing and attempting to wait the virus out until we have a viable vaccine, which could take as long as 12 to 18 months, or accepting that most of us will get the disease, putting those who are more at risk into isolation, while the rest of us get the disease and let it run its course to completion. The first option is definitely the safest, though it puts a significant strain on worldwide resources, especially from a fear and panic point of view over the total period of time it could take to develop a vaccine. The second option, whilst potentially more dangerous, presents an opportunity to get ahead of the disease and prevent spread. If everyone who is not at risk of significant fatality contracts the virus, an overwhelming majority will be perfectly fine and then will become immune after the viral period. If everyone is able to do this worldwide, then there will be a herd immunity developed in a short period of time, therefore preventing a huge strain on worldwide resources over months or years. This option is very difficult and most likely will not happen, but it is an option nonetheless. My main point of all of this is, if you're not at significant risk, there is no need to fear or panic. There is a very strong likelihood that should you get COVID-19, that you will be perfectly fine and then develop immunity once it has run its course. Whilst you should not panic about the disease, I would definitely recommend understanding hygiene practices. It is always good to be self-aware, especially because whilst you may not be at risk, others around you and close to you may be. So be aware, be vigilant, but stay strong, and this will all eventually pass. Thank you all so much for watching the video. If you enjoyed it, please make sure to drop a like on the video, as it really does help it out. Leave a comment. If there's anything I've missed, I'm happy to discuss it in the comments down below. And if you really enjoyed this video and videos that I make like it, please make sure to hit that subscribe button and join the Northpolepenguins community. Thank you all so much for watching, and until next time guys, stay safe and have an awesome day.